And if you're just joining us, we're with J.O. Are you a doctor? I always want to call you Dr. J.O.
No, I'm not a doctor. I'm a financial person. My late father was a medical doctor. I'm a financial person.
No, I know MBA, CFP, all these initials after your name. I didn't know if PhD was one of them.
No, it's not.
So, did you do any research on that or not really?
Well, I think that data is, certainly looked for, but I don't think that I've seen it in print.
Because in my gut, I would say, man, it's going to add to the deficit, which is why it was kind of shot down. The deficit hawks, the guy that always is talked about, Joe Manchin, who, he's apparently the most powerful man in the country right now. People act like he's a moderate. I don't really think he's a moderate. I think he's more like the old school Democrat of maybe 30 years ago. The infrastructure bill is still like 1.5 trillion. Apparently they're raising that. I don't know what the cap is now. Do you know what the cap on that is now? What's the latest on that? Have you researched
They're trying to find some middle ground right between this 1.5 and 3.5 or something like that. I'm not keeping up to date because it moves and changes, and
every day.
Who knows on what rationale is being used.
So talking
but
about,
I think that you're right.
Medicare. So if you have somebody who's 60, 62, they're forced out of their job, what do you recommend them to do for health insurance? You recommend them, sometimes we say, hey, go work at Home Depot or Starbucks or some place where there are some employers now, 20, 30 hours a week, you get health insurance. And they highly subsidize it.
Certainly that's an approach.
$15 an hour. What else would you recommend them to do to save on health insurance costs if they retire at 60 but have to wait till 65 to get Medicare?
And I think that the last time we spoke, Josh, I hinted at it during the time that we were allotted. So as a result of the massive amount of governmental assistance, I think the one thing that did not get enough attention was the fact that the tax credits, they're called technically advanced premium tax credits, which are basically cash credits which are pulled up front to reduce your health insurance premium. So what was $1,500? Clients in Florida, for example, you can understand very moderate incomes in expensive parts of the country, just like where you're physically located. Very expensive health insurance, but the advanced premium tax credit's so high to drive that $1,500 a month down to as low as zero in certain instances, that depending on a large number of moving parts. So you need guidance and help, but it is there if you know how to take advantage of it as a possible alternative, like you said, to taking a part-time job at Walmart as a greeter and then getting the requisite number of hours per week.
Yeah, give the sticker out with the smiley face.
Right.
And folks, give us a call now, 888-988-JOSH, and you'll get the free book by Jay, Maximize Your Medicare. That'll be our free gift to you if you schedule and keep your no obligation review at 888-988-JOSH. And we're back. This is Josh Jalinski, the financial quarterback. I was going to say it again, Dr. J.O. Well, the doctor of Medicare.
Dr. J is a basketball player.
Yeah, Dr. J. So the Biden administration's $3.5 trillion social spending plan has a lot in it, to put it lightly. Can you break down any parts of it that will affect Medicare should it pass? And then I do want to bring up that advanced premium Medicare thing, because we don't really... Is that gone? If we didn't take action by August, are we done?
No. So if we take your first question regarding the infrastructure bill, part of it is to add dental, vision, and hearing inside of original Medicare, which is the federal red, white, and blue card. That also is the subject of heated debate and political horse trading as people try to grapple with the cost even of that. And there have been a number of proposals none perfect, of course, in our imperfect world, about how to approach that. And then, of course, as I hinted at earlier, that the opponent in the stakeholders in healthcare delivery are so enormous, and they have their rationale. Certainly, they have the rationale, their point of view. Where you stand depends on where you sit, of course. And you have opponents who are very, very well organized. And, for example, even on the dental, vision, and hearing, the ADA, the American Dental Association, is against it and now galvanized towards that end. Nevertheless, on both sides of the aisle, fairly popular amongst the wide majority of Americans, because it is a notable omission from original Medicare, no question.
So Medicare, they're going to include vision and dental if you are 65 or older. The dentists are against it because some of their most profitable clients are obviously seniors in need of dental work. I mean, that's one of the biggest expenses in retirement that people don't. Do you want to talk about that a little bit?
Sure. And basically, when we talked about, and it is very similar to the pushback that you're seeing in lowering the Medicare eligibility age, which is that would basically make the federal government, the CMS, the price setter, the reference price setter of services for healthcare services. So, for example, you can understand why, if you're an insurance company, whether you're a hospital, rural hospital, or doctor, the payment rates from the CMS are lower than they are, for example, your employer-sponsored plan, your Affordable Care Act plan. And so you can easily attach that same logic to why the ADA would be against the proposal where the federal government was basically price setting for a large number of their patients.
So who's going to win, the dentists or the anti-dentites? Who's going to win?
That's a good question, because as I said, I think that is a common cost, like you rightly pointed out, which doesn't know a political party. You got a toothache. You've got a toothache. It doesn't matter whether or not you are for or against the infrastructure bill, and it's so popular. And like you pointed out, that the cost is very high, and existing the way that dental insurance works as a financial contract isn't really insurance. I tell this to our clients. I don't have a problem if they're interested in purchasing for whatever reason, but just as long as they understand the structure of the financial payout, the cash flows, is not like their health insurance at all. So it's kind of a misnomer to call it insurance, but nevertheless, you can understand that would be wildly popular if added to the original federal card of Medicare.
So give us a prediction. Will it pass with the dental provisions or not?
I'd have to guess that the answer in some form is going to be yes. If I were forced to choose yes or no, then I'd probably say yes. That said, you then have some operational issues. You don't get to flip the switch to turn it on. There's a lot of infrastructure and payments, etc. Who's going to be included, who's not. That entire network, the way that it would work, possibly just from an operational point of view, isn't completely established yet, not entirely. Now, certainly the skeleton exists. Whether or not it's ready for the broad adoption to 63 million, that I don't think happens overnight.
Wow. So that may be a good idea for many people, so they get dental coverage. Although the dentists listening are not going to be happy, because it's basically
they might not be as happy at getting a lower payment rate. Who would be? That's what I'm saying, is that those persons from whatever stakeholder you may be, they're going to have a rational reason. I'm not under the presumption that anyone is foolish or isn't looking out for their best interest rationally.
So it's really everybody against the dentists, is what you're telling me.
Not me. No, a number of our clients have that background, so no, I can't really be out there saying that. But as a group, much like certain parts of, for example, insurance companies would not necessarily be happy at all if you lowered the eligibility age from 65 to 60, even if they didn't lose clients because of the fact that they would be Medicare eligible.
Yeah, but
difficult stuff.
But that'll cause the cost of the insurance to go up because more and more people will, the burden will be spread on these insurance companies. So nothing's free,
The feedback loop is incredible, no question about it. And that's why when you asked for a hard and fast answer to predict or what the net cost would be, I think that's a very difficult calculation to even make, much less than to be proven to be correct after the fact. For a 62-year-old, however, I would definitely encourage back to kind of what you were saying as far as strategies go. I would definitely take a look at the Affordable Care Act and the way that the advanced premium tax credits, and then also that has a ripple effect on financial planning as a whole. There's no doubt about that.
The preceding program was sponsored by the Jalinski Advisory Group.
Any awards, rankings, or recognition by unaffiliated third parties or publications, including 5-Star Wealth Manager, Advisory of the Year finalist by Senior Market Advisor, and Top of the $1 Million Roundtable, are in no way indicative of the advisor's future performance or any individual client's investment success. No award, ranking, or recognition should be construed as a current or past endorsement of Josh Jalinski or Wealth Quarterback LLC. Information regarding specific awards, rankings, or recognitions is available on the Wealth Quarterback website at www.jalinski.org. All investment strategies have the potential for profit or loss. Investment strategies such as asset allocation, diversification, or rebalancing do not assure or guarantee better performance and cannot eliminate the risk of investment losses. There are no guarantees that a portfolio employing these or any other strategy will outperform a portfolio that does not engage in such strategies. This broadcast should not be construed by any client or prospective client as a solicitation to effect or attempt to effect transactions in securities or the rendering of personalized investment advice. Due to various factors, including changing market conditions, the information discussed in this broadcast may no longer be reflective of current positions or recommendations. While information presented is believed to be factual and up to date, Josh Jalinski and Wealth Quarterback do not guarantee its accuracy, and it should not be regarded as a complete analysis of the subjects discussed. The tax and estate planning information discussed is general in nature, is provided for informational purposes only, and should not be construed as legal or tax advice. Listeners should consult an attorney or tax professional regarding their specific legal or tax situation. Advisory services offered through Wealth Quarterback LLC.